Let me sincerely thank for this opportunity. I'm going to talk on this topic, mental health and well-being in medical education, in three divided parts. Why the present medical graduates are facing problems. And second, what are the measures to be initiated by the management to prevent such issues. And third, of course, individual measures. The first sentence in the Harrison Manual of Medicine goes like this. Medicine is ever-changing science. What a visionary statement it is. In the last 50 years with the technological advancement, we have come a long way from antibiotics to atypical antipsychotics, from ordinary X-rays to functional MRIs, colonoscopes and other scopes, computer pills for interventions and investigations, and of course, artificial intelligence modulating data from which we are able to formulate treatment strategies and preventive measures. Medicine is becoming increasingly technical. So also, the medical graduate and the future therapist and the medical curriculum, they have to be in tandem with this advancement, with this technology. Then we have to go back and see the history of medicine. Gone all the days where doctors were considered as demigods. There is enormous amount of consumerism, and we are living in the world of information explosion. Google is also manufacturing doctors periodically, and they question our answers. One has to know the present state. In the beginning of the 20th century, the father of modern medicine, Sir William Osler, he said, a therapist with a technical knowledge and scientific update should analyze the patient's profiles so that he would be really coming across differential diagnosis from which he has to travel to the destination of final diagnosis. His statement, ordinary doctors, they treat diseases. Great doctors, they treat patients. It's worth remembering. 1992 saw the emergence of evidence-based medicine, and subsequently, I think, 93 saw the birth of patient-centered care. There is an emphasis in 2000 to integrate evidence-based medicine and patient-centered care in 2000, and for that they highlighted one important factor called communication. Communication doesn't mean that one has to indulge in a lengthy verbatim. I think the fundamental aspect of communication is listening, not the process we employ with our spouses, that is hearing. They listen in such a way the patient is interested in talking to the therapist. And the therapist should talk in such a way the patients are interested in listening to him. And 2007, there is a voice that patients also should be involved in the treatment-related decisions. And that was the period where they started highlighting informed consent. With the advent of proteomics and metabolomics, personalized medicine emerged in 2013. And with the genetic understanding at an advanced level, that probably helped us to really formulate novel treatment measures and also prevention strategies. And that is the birth of precision medicine in 2015. COVID-19 was a black swan moment, and we had to really be in the domestic milieu. Confinement was the way we really led our life. At that time, telemedicine, M-medicine or e-medicine, that was the avenue for most of the patients. The futuristic medicine is going to be personalized, patient-centered precision medicine. And here comes the holistic medicine. What is holistic medicine? It analyzes the impact of the physical, psychological, social, cultural, spiritual factors on health. It analyzes the root cause of the problem and tries to really restore the balance. Just possessing the technical skill and scientific knowledge is not enough for the therapist, and one has to possess the less emphasized traditional skills. It is not a philosophical preference, but an evidence-based necessity. Making a diagnosis of diabetes mellitus is easy, but one has to be emotionally intelligent to explain to the patient. He must possess high EQ. What is emotional quotient? Understanding his emotions, understanding the patient's emotions, understanding the interactions between his emotions and others' emotions, and trying to get the best beneficial effect of this interaction. Second, he has to be culturally competent. Just prescribing drug is not enough. Unless until he knows the socio-cultural background of the patient, I don't think the therapist would be in a better position to talk about the dietary regimen. Third, he is a collaborator. Imagine a doctor is making a diagnosis of depression with a suicidal ideation and prescribing a female antidepressant and lithium. Imagine the female is becoming pregnant. In the first trimester of oogenesis, there is a deleterious possibility of Epstein anomaly, and so the psychiatrist has to interact with the physician to switch over some other drugs. Another problem arises in the postpartum period if the lady is allowed to continue the antidepressant because the newborn is unnecessarily going to get a small dose of antidepressant. So this psychiatrist has to really interact with the pediatrician for any other suggestions for the child for feeding. Third is a leader. Quite often our leaders are probably opportunists, even in the medical field. When something goes wrong, the resident or the junior doctor became the victim or the scapegoat. If something goes wrong, if a mistake is committed, I think the therapist should really accept himself. And there is a beautiful article in American Milieu in 2015. It states that every 73rd day the medical information is getting doubled. So unless and otherwise he is upgrading his knowledge, he is going to be a frog in the pond. Next is mental health. Here, about mental health, a lot of misconceptions are harbored even by our colleagues, even by the erudites. What is mental health? It is a sense of well-being. It is an ability of an individual to operate strategies at the time of facing any conflicting situation, and at the same time, ability to really contribute in a meaningful way for the personal and the professional level. And here I would like to reiterate, nobody is normal, including me. A visitor to a mental hospital wanted to see the varied nature of the patient. He was taken to a particular ward and patients are asked to stand in a row, and he saw one person crying in a profuse way. Why you are crying? The visitor asked. I loved a girl by name Sheila. Hope nobody knows Sheila is here. Don't worry, my spouse's name is Sheila. Name Sheila. It was a platonic love. I wanted to marry her, but somehow I was not able to marry her, became depressed and got admitted here. Don't worry. You can always find another woman in your life. Maybe in the old age, I think you may start with sentiment and hence a settlement. That's a different issue. The patient was carried away by this brief counseling. Then in the fourth row, there is another person crying in the same frequency. He was not able to marry a girl by name Sheila. I am the unfortunate husband who married the Sheila and currently experiencing hell. One man's problem is another man's fortune. One man's food is another man's poison. What I think is my cognition and what I deliver is my communication. I am, you are, we are analyzed, deciphered, concluded, assessed by our communication. We may think something else in an obscene way with a beautiful filtering mechanism thanks to the frontal lobe and control over yourself. By communication, we really try to give a different picture. We wear a mask. That's the reason I'm saying we are relatively normal, we are relatively abnormal. Whenever you see a mental patient, a psychologically disturbed individual, I think, remember this particular statement. Why present medical students are more stressed? I go by 2019 statistics by NMC. 1.4 million people appeared for the exam, nearly 8 lakhs qualified, 1 lakh and 50,000 UGs entered medical colleges, 30,000 postgraduates, 604 medical colleges, 306 government, 288 private, 10 semi-private. An MBBS packed with 19 subjects. There are presentations, assessments, lectures, assignments, clinic-based practicals, and examinations. Internship in government hospital is hectic with the limited resources, even in some of the private colleges. And junior doctors, they become the victim. And there is a poor support system. And some of the students, especially in the pre-final and final year, they go for the compassion fatigue. The so-called DRP, rural posting, I think, you have the administrative and academic and clinical challenges. There are so many studies highlighting so many reasons for mental health issues. But I would like to quote the mental health survey conducted by the National Medical Commission, which was released very recently in December 2024. Diagnosable mental disorder among UG, I think, present to the extent of 27.8%, whereas postgraduates 15.8%. 84% of the postgraduates, they have moderate to severe stress because back to back they have academic sessions. In a week, they have clinical meetings, symposium, journal club, night duty, and especially posting in casualty, labor ward, or IMCU or ICU, hectic. They don't have rest. And suicidal thoughts are being harbored more by the postgraduates. By the time they have to think about their marriage, they are not able to strike a balance between the personal life and the family life, and separated. Though I think there is a little freedom, the separation from the mother-in-law, child may be there. And so many issues are there for the female postgraduates. Alcohol and tobacco, 19%, and extreme financial difficulties, 33.9%, because invariably most of the undergraduates, they pay more tuition fees or more other fees. 72.2% of the postgraduates, they complain that stipend is very, very, very insufficient. And this is another problem, loneliness. Thanks to our gadgets. The present generation, probably they started believing that they have everything with a gadget called mobile phone. I don't want to go to theater, I think I can see OTT. I don't want to go to a restaurant, yes, Swiggy is there. I think I don't want to go to shop, again I can get anything and everything. I have 1,400 followers, but you don't have any meaningful friendships. 39.1% they have loneliness sometimes. 1 in 10% among medical graduates, they complain loneliness. And suicide among medical students between 2018 to 2022, 64 among undergraduates, Kerala 9, Tamil Nadu 8, among 58 PGs, Maharashtra 11 and Karnataka 11. Reasons: academic pressure, lack of mental health support, and pressure to excel. Substance abuse, alcohol 40%. Another trend is emerging. In our days, I think men were drinking more, men were smoking more. Smoking was on the higher side. I'm talking about the status of 50 years back. Now, women are drinking, they also started drinking and they also started smoking, and it has come to a significant level. Saturdays, I think really, they go to a restaurant and they prefer, collective drinking. And cannabis to the extent of 8%, but dependent pattern is not seen in India. And alcohol and tobacco statistics, it's in tandem with the statistics of other worlds. And of course, stimulants and hallucinogens, rare. What are the stresses of MBBS students? First year, you don't know what is happening there. Academic workload, financial difficulties, very difficult. In my anatomy, I really vividly recall my viva. They were asking questions. I was indulging in titubation. Puriyila, subject theriyila. They were thinking that I didn't know the answer. Avangalukku theriyadhu, I didn't know the question itself. That was my problem, right? But unfortunately, the present generation, they are extremely sensitive. The present academic MBBS curriculum is probably making the postgraduate to think that a small mistake is a failure, a disastrous failure. And that's the reason they are really, in an impulsive way, they go for a terminal exit. Second year, the competition with the peer group. Third year, time spent for commuting and placements, romantic relationship becomes toxic relationship, and they are not able to strike a balance between work and life. And finally, when you're posted in the trauma ward or terminal illness ward and seeing the suffering of the patient, probably you go for a kind of a compassion fatigue. And risk factors for mental health issues. For example, for pulmonary tuberculosis, I can say the reason is Mycobacterium tuberculosis. But for mental illness, I don't think I can really categorically say there is one single reason or single cause for mental illness. The reasons are multifactorial. I may be having a genetic loading. My parents may be schizophrenic. My elder sibling may be schizophrenic, but there is no hard and fast rule that I should become schizophrenic. Problems in the person, problem in the interaction with the family, and problems in the social interaction, how I perceive the stressful incident, how frequently I am facing stressful issues. So many factors are at that time, what kind of support I am getting. These are all the factors to decide whether I should really go for a minor neurotic problem or a major psychotic problem or a personality deviation. Wellness. What is wellness? It's a general and personal sense of well-being. It's always changing and evolving. At times we feel good, at times we feel bad, but that should be considered at the personal level. Of course, it is supplemented by other levels. As a medical learner, what is wellness? Whether I am able to really contribute extra time for the research-related activities, whether I am able to show some interest for ICMR projects or some other projects, or whether I am really going beyond a level and preparing for medal exams. Am I in a position to think about my future? These are all the indicators of wellness as a medical student. There are types of wellness: social, mental, physical, intellectual, occupational. What is social wellness? How far the medical student is connected with the social milieu? How far his views, expressions, suggestions, desires are accepted? How far he is feeling a kind of a belonging? Second is the mental wellness, realizing his own potentials, ability to operate the strategies at the time of facing any conflicting situation and trying to restore the balance. For problems, I think there are solutions. For some problems, I think there are no solutions. You have to live with that. Very difficult. People are just probably tolerating me as a husband for many years. That is the problem of my spouse. So you have to accept and probably tide over the crisis. Physical wellness. It is maintaining optimal level of activity, having an adequate energy, probably allotting some time to really do some exercise, thinking about nutrition, and it is not just doing but being thing. Intellectual wellness, it's pursuing overactivity, how far I can stimulate my learning process, how far I can harness my skill or refine my skill, how far I can really indulge in creative tendencies. And occupational wellness is knowing about the hazardous issues in the work milieu and trying to really prevent and protect yourself. Burnout. Burnout is nothing but exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. It leads to emotional exhaustion. You lose the passion. There is an arousal. I think poor concentration, memory lapses, and you start avoiding people, and socially, you start withdrawing yourself, and depression, apathy, and negative ideas, and slowly the person, I think, may not be really participating in the social activities, unexplained absences, frequent sick leave, and slowness in the procedures. If your required work is probably fitting with the meaningful work, you will have a professional fulfillment. But unfortunately, they do not have any kind of a tandem relationship, and that's the reason we really suffer. What is empathy? Majnu was saying, Laila is the most beautiful girl. Somebody retorted, Sadharana figure Mardana irukku. Get into the shoes of Majnu and see through the eyes of Majnu, Laila would be appearing beautiful. Sometimes, I think probably some ladies, they may be complaining severe headache or abdominal pain, and she is visiting various doctors, and finally a diagnosis of hysterical manifestations or functional pain that is made. Once the diagnosis of functional disorder is made, I think there is a reluctant attitude, even from the psychiatrist's point of view. They may be thinking, you don't have any organic basis. No, we fail to really know the pain is real, the suffering is real. The cause may not be in the physical system, but everything is perceived in an indifferent way. So empathy is probably, perceiving from the patient's perspective. It is a cognitive empathy, appreciating others' mental state, automatic and reflexive. Affective empathy, reasoning with the feeling of others, reflective. And motor empathy, mirroring others' emotions. Compassion fatigue. If empathy is perceiving from the patient's perspective, compassion is something one step above. You just want to do something for this patient. I'm not able to do anything for this patient. This patient is dying. This patient is suffering. In spite of giving alleviating measures, I think he or she is not coming back to the previous level of equilibrium. You started really getting some negative ideas in your cognitive realm. So, compassion fatigue, stress or tension that arises from frequent contact with the traumatized people, where we become preoccupied with the pain or the suffering of the other people. Diminished ability, flashback, intrusive thoughts, hypervigilance, feeling like a failure as a helper, and you have trouble in separating personal and professional life. How to overcome? Have a balance between compassion and empathy. Please share this emotional feeling with your classmate or start writing about this emotional experience. What are the management standards, measures to be initiated by the colleges to prevent mental health problems? 6 factors have to be considered. 1 is the demand, 2nd is the control, 3rd is the support, 4th is the relationship, 5th is the role, and 6th is the change. What is the demand? It's concerned with the work milieu. It's concerned with the workload, whether the educational curriculum is adequate, whether the students' skill or the teaching or the learning. I think it is enough to really accept this curriculum, whether the students within the time frame would be in a position to compete and complete this educational curriculum. And what are the interventions? Curriculum review should be there. Students' view should be incorporated. And if there is any other concerns from the students' side, I think try to reduce the administrative bureaucracy. Inquire. You're not going to give from the packet. Guide them about financial management. 2nd, control. This is about how they study. I think some people may be really in need of a peer learning or personalized study. Encourage personalized study or peer study, and review each and every student's ability every 6 months. allow them to get exposed to pre-recorded lectures, or allow them to really attend workshops. Third, support. This is about encouragement, support systems, and review of resources. And faculty should be encouraged to help the students. And students should be encouraged to form their own community comprising of juniors and seniors in order to better learning process. And students should receive constructive feedback. And fourth is the relationship. Provide a conducive, supportive environment. There should not be any room for any ragging or physical or psychological harassment or sexual abuse. Enforce strict measures. What are the anti-ragging measures? Have to be advertised throughout the campus and see to that it is really followed properly. And whether the predictive policies of the management is known to other people, other students. Role. Tell them that he is a perpetual learner. Explain about all of the examination system. Announce early. Deadlines should be really known to the students well in advance. If there is any change in the organizational milieu, that should be noted and should be advertised, and every student should know about it. And what are the prevention mechanisms for mental illness and attempted suicide? Pharmacotherapy. Maybe antidepressants or lithium if the person is going for active suicidal ideas, or non-pharmacological management in the form of cognitive behavior therapy, brief counseling or psychotherapy, and follow. For students at risk, screening, detection, intervention, gatekeeper training, which I'll be explaining later, and preventing access to weapons. For all students, there should be awareness programs, anti-ragging measures, stress management, time management, mindfulness, access to treatment. Secondary prevention, stress management. Talk about nutrition. And especially the duty room should be in a safe place, and nutritious foods should be served to the duty doctors, postgraduates, and exercise. Talk about sleep hygiene. Most of the psychological disorders, they are extremely correlated with the sleep disturbances. Even the established diagnosis of mental illnesses, when they are in remission, if the person is experiencing sleep disturbance, there is a possibility of relapses. Substance abuse, cognitive behavior therapy, mindfulness, and resilience. Tertiary prevention, destigmatize stigma about mental illness. Nothing wrong in seeking help. And include the family members. Mentor. Mentor is a role model. He helps at the personal and the professional level. He provides input, guidance about research, clinical work. He builds confidence, competence, and he acts as a coach. But the important aspect of the mentor, he creates psychological safety. Na irukka, I am here, don't worry, even if anything happens. If your teacher is criticizing, if you are getting below average marks, if you are marked by your peer group, I am here to help you. I will provide emotional support. That is the basic expectation from a mentor. I think people talk about the group mentorship because of time and cost factor, but nothing like individual mentorship. And nothing wrong in reflecting his personal struggles. Nothing wrong, I think, because I am seeing a person, he's almost like a celebrity for me, he's a mentor. I have placed him in this position. Oh, he also faced certain failures in his life. So nothing wrong in really facing a failure and really tiding over the crisis. So mentor, nothing wrong in explaining his own personal struggles. And coaching. This is distinct from mentors and advisors. What exactly used in coaching? One is the inquiry, and second, encouragement, accountability, and reflection. If formal coaching, if it is helping a clinical practice, and informal coaching, it helps really in inculcating personality traits, self-awareness, and aptitudes and interest. Gatekeeper training. What is a gatekeeper training? Gatekeeper is a person who identifies the risk of suicide among medical students. Who can be a gatekeeper? Anybody, class leader, a particular assistant professor, or a teacher, or in the social milieu, I think any volunteer, or police, or any socially well-placed person. And what exactly is happening? He's given training for 3 hours about identifying the risk of suicide and followed by didactic lectures, audiovisual depictions and brainstorming sessions. And there is a pre and post assessment about identification risk with a particular validated suicide risk inventory scale, and the outcome is really good. This is important. This should be highlighted. There is a telemenus calling system for mental health formulated by Union Government of India. The number is 4416. It consists of a caller, IVRS band, counselors, and mental health specialist. If the person who is in need of a particular problematic situation, he wants to seek solution, maybe he wants to consult a psychiatrist or a psychologist in person, yes, facilities are there, e-prescriptions are there, and 52 telemenus cells are there, 23 mentoring institutes and 5 regional coordinating centers. Till October 2024, there were 14.7 lakh calls, and it is reaching the unreached and vulnerable population. I think students should know this number. Second, another therapy, individual therapy, is mindfulness. Mindfulness is nothing but state of active, open attention to the present. You are without any kind of a judgment, without analyzing your emotions at the time of facing any conflict. You just observe, experience that state, become aware. I have a problem, I failed in the exam, there is a loss. Do not analyze, just go for a surface float rather than go for a deep sea diving. Then second, awareness. Yes, it had happened, I should accept it. Awareness and acceptance. They say it is reawakening a present state. Life is nothing but existing in a present continuous form. When you think about the past, you become upset. When you think about future, you become anxious. Live for the present. This has happened. Yes, I should be aware of it. Awareness. Second, I should accept it. People say mindfulness really helps people in a better way. Second, resilience. Yesterday, I think Professor was talking about resilience. Viktor Frankl. Viktor Frankl, as a neuropsychiatrist, he was really confined in a Dachau camp. He lost his father, mother, wife, brother. Almost he became like a solitary reaper, and he lost his sleep every day. He used to sit by the side of the window and used to gaze the stars. One fine day, I think he had a flash of my idea in his cognitive realm. In this world, nothing can prevent negative event. He called it as a stimulus. Nobody has got the control to stop or prevent the stimulus. Then you have to respond. Here, what he said, between stimulus and response, there is a freedom of choosing the response. Let anything can happen to me, but I have the freedom of choosing the response. As long as I have the freedom, nothing can affect me. He formulated a concept called logotherapy, and he had written a beautiful book called Man's Search for Meaning. If at all there is a book of survivors' Bible, in the last 100 years, I would recommend that book. Please read that book, Man's Search for Meaning. What is resilience? It is adaptability at the time of adversity. If you possess all these 7 qualities, yes, you can proudly say, I can face anything. What is competence? Think about all your qualities you possess. Confidence. Try to think about whether you are in a position to use those qualities at the time of adverse situation. Third, connectedness. When you are having a problem, get connected to your personal level, social level, familial level, and try to be in tandem with all these 3 domains. Character, it is a fundamental aspect of your personality which differentiates the right or wrong. I'm going to choose the right pathway. Contribution is the motivating factor. Coping is the actual dealing with the stressful issue. Control. Think that the locus control is within me. I'm going to face this problem. I'm really facing this problem. Whatever happens, positive or negative consequence, I'm going to accept it. People who believe that the locus control is inside, they have a better stress tolerance, they use their past ability, and they have better sustenance than people who believe for anything and everything. I think people look for external milieu. When I fail in the exam, The second, the assistant professor failed me. No, he didn't like me. Do not search for cause for the failures, especially in the external milieu. Cognitive behavior therapy, it's a wonderful non-pharmacological management, especially for stress management. What really happens? When an individual faces a particular problem, he automatically develops a negative thought. That automatic negative thought is resulting in unwanted emotions, and that unwanted emotions are not properly processed in the cognitive realm, which is disturbing the psychological equilibrium. Ask the person to revisit the particular same incident. Ask the person to think about other possible thoughts. Let the other possible thought substitute the originally occurred automatic negative thought, and the emotions could be averted, and it's possible to retrieve the previous psychological equilibrium. Progressive muscular relaxation, this can be practiced. It is based on a principle that when you are upset, when you are facing a conflict, both mind and body, they become tensed up. Try to relax the muscles of the body part by part. At one point of time, the head to foot, all the muscles are relaxed, and you will feel that the mind is also in a very relaxed level. Deep breathing exercise. There are 4, 7, 8. 4 seconds breathe in, 7 seconds hold your breathing, 8 seconds breathe out by mouth. And probably, another way of really, harboring a positive, optimistic thought when you face a particular problem. It is not thought substitution as we really practice in obsessive problems. When you harbor an optimistic, positive thought, I think endorphins probably they escalate. And the reward areas like nucleus ambience and ventral pallidum, they are said to be in a hyper-excited level. And your attention is good, concentration is adequate, and your judgment is beautiful, and you are like a settled batsman in the 10th over who could see the cricket ball, something like a football, and you would be in a position to smash the ball for 4s and 6s. Time management. There are so many management techniques. I just want to say 6P. Prayer, proper prayer, planning prevents poor performance. Especially, in the examination study holidays, you plan that it would consume 100 hours to complete Davidson or Harrison General Medicine, and immediately we start reading, only very few people would be in a position to complete it. Instead, take 10 hours, and during 10 hours you plan for it. I'm going to allot more time for central nervous system. I'm going to allot some time for cardiovascular, some time for definition, some time for investigation. Should I spend time for psychiatry? Not necessary. So utilize the 10 hours in planning. If you do like this, all of us would be in a position to complete within the stipulated hours. Flow. Flow is a psychological principle. Flow, people really getting involved in a particular work, they are totally immersed, totally involved, they are known as autotelic people. Have we seen in a rural tea shop, I think the between two containers, the person will be really indulging in an activity called decanting, reducing the heat of the tea. That's such a beautiful, I don't know, even Bharatanatyam, they used to say, Adavu. Namlala summave oru idha edukka mudiyala. That is flow. When you are worshipping in a sanctum sanctorum, what you are experiencing, it's a flow. When you are interacting with your girlfriend, absolutely vibrating in her frequency or your frequency, we are not bothered. The conversation continues, flow. So when you practice flow, if you are able to modulate your anxiety in a better optimal level so that your performance is in flow like fashion, I think people know they will not be really bothered about the consequences. If people work for reward, people who practice flow, work itself is a reward. They don't seek any kind of an incentive, they don't draw attention. Our chief varumbodha nama vela seira maari nadipom. HOD varumbodhu, they never do that. You are enjoying for your sake. Practice flow. Humor. Humor is a fantastic quality. Especially, Tumbam varumbodhu siringa. That was the statement in Tamil. Without sense of humor, approaching a problem is like taking an image With a tripod camera, you can take only one particular angle. But with sense of humor, capturing an image is like capturing an image with a drone camera. 360 degree you can take the image, and maybe if you have a sense of humor, at one point of time, immediately you react. You borrow some time with sense of humor, probably that's called response. Maybe in that borrowed time, from a different perspective, you may be seeing a kind of a solution. My last slide. What are the recommendations to have a better mental health? Orientation programs we conduct, stress management, time management, talk about communication. Instead, along with these programs, ask the students to showcase their abilities. Let them have sports-related activities, let them have musical night, let them have talent show, let them have dumb charades. And for another 4 days, I think let them enjoy. Second, invite parents and family members. Anti-ragging measures, I think, should be strictly enforced. There should be awareness campaigning program about stress management, time management, brief counseling, gatekeeper training, and destigmatizing about mental illness, and knowing about telemenace. There should be staff students clinic, and the free medication and free treatment should be given, and regulation of work hours. This mental health survey, which was conducted by National Medical Commission, they recommended that they have to work for 6 days. 5 days, 6 days, 10 hours, 60 hours. The 6th day, 24 hours duty. So 74 hours, 1 day rest, and little lenient leave during maternity period, and especially postgraduates posted to the labor ward or casualty or ICU or IMCU. Next day, I think they should be really, handled with a little bit lenience. Safe and supportive measures, especially duty rooms. Duty rooms of the postgraduate should be in the department. And it's better, I think, to serve the nutritious food also. And supportive family and child care. If the person is having some psychological problem, maybe in a particular nearby hostel or nearby room, the mother or parents can stay and really help the student really pass the exam. Assessment method should be changed. Instead of marks, go for a grading system, pass or fail. Even in announcing the results, do not publish the name. Just numbers are enough. And transparent and response grievance redressal must be there. E-complaint portal should be there. Mentor-mentee program should be there, and it should be properly evaluated. And so also gatekeeper training program. Supplementary exam. If I'm failing in April, I think there should be another exam in June, and there should not be any possibility of missing the batch. The batch miss pandrathu romba kashtam. It creates they are little bit alienated. In Stanley, I had seen many people, some of my own classmates. Somehow, I was below average. At the mercy of the examiners, I was able to pass. That's the reason. They gave me a pass. I didn't get the pass. And mental health well-being committee should be formed, and periodically they should meet. And this is my mind map for this particular topic. And more than that, I think try to really talk everything in person, and life exists in offline only, even for academics. And so many webinar programs you are conducting, and put on camera, I think one-to-one interaction. There should be attempts to really make everybody communicative in the real sense. Thank you very much. Queries are welcome.